Good afternoon, ladies and gentlemen. I am Liu De from Nanfang Hospital, Southern Medical University, Guangzhou, China. I'm honored to have the opportunity to join the virtual event of Hong Kong Nerve Endoscopy. Today, I'm going to talk about the latest development and clinical application of capsule endoscopy. Firstly, I'm going to talk about the clinical application of a magnetic controlled capsule endoscopy system. The handheld type of MCE includes the OMO system developed by Jinsan Company and the MicroKane system by Intramedical Company. This is the OMO NC100 model, which can be manually controlled with a variety of equipment. And the newest version from OMO, the automatic navigation capsule wrapped, the type of raptic arm magnetic manipulation includes the decubitus ankle navigation system and the Zifu system. At present, the ankle magnetic navigation system is one of the most frequently used type of MCE in my institution. The image on the right side shows a standing examination system called 大圣之符 system. This is compilation of different types of magnetic capsule system. As we can see, most models can be used for both gastric and small intestinal examination. A couple of studies have shown that it is feasible to completely realize the methane wheels. In the upper GI tract used MCE, there were positive concordance for minor pathological fading when compared with standing gastroscopy. However, some improvement was still required for optimizing proximal gastral view. We participated in a multi-center blind study compared MCE with conventional gastroscopy in 350 patients with upper abdominal complaints. MCE detected gastronasal with 90.4 sensitivity and 94.7 specificity. In 350 patients, we detected one advanced gastric cancer, two malignant lymphomas, and one early-stage gastric tumor. MCE did not miss any tumor or large answer. More importantly, 335 out of 350 patients performed MCE over gastroscopy. Another study from Shanghai demonstrated that MCE is feasible and safe for gastrointestinal tract inspection in children. Apart from patients with upper GI complaints, MCE is a promising model for upper GI cancer screening. A multi-center retrospective study evaluated the feasibility of medical concentrate for screening upper GI cancer by MCE among 3,327 patients enrolled. The MCE detected 362 patients with upper GI cancer. The detection rate of any gastric cancer was 16%. However, for the prospective study with better operation quality control are warranted. Since 2015, we have completed 20,161 cases of capsule endoscopy in the Department of Gastroenterology, Nanfang Hospital. From 2016 August, we started to use the MCE, and to date, we have performed 4,135 cases. The majority of these MCE were on-hand capsule endoscopy, and 319 cases was almost magnetic capsule endoscopy, and the rest were Zifu capsule. We retrospectively evaluated these cases done from the past 10 months of 2021 in our health screening center. All cases were performed using an ankle navigation system. The detection rate of gastroatrophy was 1.4%, and the rate of erosion, polyps, gastroanther, and submucosal tumor was 64.2% and 11.4%, 1.3%, and 1.3% respectively. In addition, we regularly selected 2 months data. The positive rate is calculated using the number of pathologies for each patient. As we can see from the 428 patients, most cases have 2 or 3 pathologies detected. Next, I will talk about clinical application of MCE. This is the comparison of the picture for normal anatomical structure of stomach talked by MCE and traditional gastroscopy. From the imaging, we can see the stomach is expanded adequately by clean water. The gastromucosa is fronted, and the capsule images are clear enough to detect even small abnormalities. This is a comparison of lesion for MCE and gastroscopy. We can diagnose gastro erosion, polyp, and atrophy with high confidence. These are lesions of ulcer, ectopic pancreas, and submucosal tumor. Erosive lesion and barrier effects also can be seen clearly using MCE. This was a patient who had foreign body sensation when swallowing. MCE revealed an invasive esophageal cancer. We can see the images of capsule looks almost as clear as the traditional gastroscopy for gastroanther. Polyps are usually easy to detect using MCE. We diagnose gastrolitis and activity gastroanther use MCE. Most types of MCE can observe small intestinal lesion very clearly. In this case, we found a stroma tumor in the small intestine. This case revealed multiple small intestinal ulcers for a young man. And for this patient, MCE revealed small intestinal lymphangioma, small intestinal hemorrhage, and a lateral development tumor. This case, the gastroscopy showed no abnormality, but capsule endoscopy indicated small intestinal ulcer bleeding. A young man with repeated hemoptysia for 3 years, gastroscopy also showed no various abnormality. However, MCE revealed lymphoma. MCE can be used for surveillance for Crohn's disease as well. The scenarios of MCE should be more than what I just talked about. Due to some problems, we studied a research project together with Xi'an Jiaotong University and Side Intelligent Digestive Examination. We constructed a large database of capsule endoscopy images named Endonet. AI system can automatically analyze capsule gastroscopy images and identify lesions with promising accuracy. Our database Endonet covered all 11 pathological types of GI mucosal lesions and more than 20 types of real GI disease. Up to date, we have enrolled images from the more than 11,000 patients. We estimated the physical quality, motor speed, and posture of capsule gastro and development and AI system to guide the CE examination in the stomach and to increase the coverage of gastro wall. The area coverage of gastro wall is duplicated in real time, guiding the posture change of the patients. This is the mobile terminal app of our capsule endoscopy, which can provide guidance to the patients about the stomach bowel preparation and how to change the posture during the stomach examination processes. Also, image workstation for doctor, which can automatically eliminate read and images and detail the lesion with the accuracy of more than 90%. In conclusion, I have introduced the clinical application and development of CE and the latest advance of our AI system capsule gastroscopy system with the advance in both software and hardware. We believe the capsule endoscopy can be more widely used in the clinical and provide even better patient experience. This is the end of my presentation. Thank you so much for your time and kind attention.